Hi everyone. Today I want to talk a little bit about hair restoration and hair treatment for those people that are losing their hair. Both men and women lose hair, and it begins early, either genetically, environment, stress, or whether you had been sick. Can be many reasons why people start to lose their hair. Thinning starts first. You may notice some shedding, hair coming out in your sink or in the shower or when you brush your hair. And for men especially, it's happening younger and younger. We're not sure exactly why. We think there are multifactorial reasons for this, including the environment, diet. But first of all, I want to tell you there's a treatment for that and a way to help prevent further loss and a way to also help yourself regrow the hair. We like to evaluate our patients first to see what reasons might be the cause of the hair loss. There are some, in men, there can be a loss of testosterone. It can be too high of the blocker of testosterone. It can be a low ferritin level. So we like to check that first. After that, if there's no underlying disease or reason, we offer treatment. And we use a staged treatment for hair restoration. The first stage, of course, is supplements like biotin. Second is to make sure you're using a topical that can help regrow the hair that you have. Now, as you thin more or have complete loss, there are more advanced procedures, including now we have PRP, which is platelet-rich plasma, which we have in our own body. We actually can draw it from you and then spit it, and then small injections stimulate hair growth. Now, as we get older, we lose that ability for PRP, or platelet-rich plasma, to work. So the next step would be exosomes, or stem cells, which we have and now has become very proficient in that procedure, in which in the past it was very hard to harvest. But now we have the ability, and it's not as expensive, so you don't have to go to another country to go get these stem cells. And that is the next step. Now, finally, of course, is grafting. Now, grafting used to be something that people learned, but was more invasive. Now we're able to, through robotics and computer technology, where we actually no incision to get your grafts. In the same day, we take the grafts and then we move them to the area that you've lost your hair. 96% of people take of the hair grafts. In smokers, maybe a little less, but overall, it's been very successful. First step is to evaluate why you have the hair loss. Second is to come in and get a consultation and find out what the best treatment for you is. And then finally, you can make a decision on whether you want to do something. Hair loss is something you don't have to live with. A lot of people feel, uncomfortable with it or say, well, I just live with it, but it's something that you don't have to. And finally, remember, women too have the same problem, and we can offer a treatment schedule for you as well. Thank you, and look forward to seeing you.